cream cheese, feel free. Whenever you're ready, Marcy.
I'm ready.
Okay. So this morning, we're going to go over care and handling of rigid endoscopes as well as general anatomy of those rigid scopes. Now, first off, they do get damaged fairly frequently, but that's mostly due to just general use. Room turnover, transportation, and just general use in a case will damage these fairly regularly. Thank you. So what we're going to see here on the inside is you're going to see that they're very, very fragile. So they look like they're all metal, but we've actually laser cut at one of our labs. We've laser cut this in half. So you can see the internal components of a rigid scope there. So what you're going to see when you look at it is in the shaft, that's going to be glass rods with little silicon clear spacers. They have a black outer ring on those spacers, so you can see that there. They do that because if it was one solid piece of glass, it's going to be even more fragile. So they try and space it out so during a case it can bend, it can move, and it won't break every single time, but it will over time begin to break down there. So we'll see here more of the internal components there. So there's two sheets actually. There's an inner sheet that holds those glass spacer rods, and then there's on the outside of the inner sheet are the fiber optic cables. So those fiber optic cables as well are also glass. They're strands of glass, tiny, tiny strands of about 100,000 strands of glass in a rigid scope. And then on the outside is another metal sheet. So it looks like it's all metal, but it's about 80% glass. Now on the distal tip, you've got your distal window, again, glass there. That's actually a particular expensive piece of glass. Do you polish here? They should polish. We polish every time we return one, but we need to polish as often as we can there on the end to keep that distal tip protected there, and then glass eye window here as well. Eyepiece, on the Olympus ones, this black eyepiece will unscrew. That's for HD cameras, so they can plug it into an HD camera there. And then your light post. So this is what it looks like. And you see little straws here on your desk, just a little visualization of how fragile they actually are. So these glass rods here, that's what they look like when they break on the inside. When we crack one open and we replace those glass rods. Can anybody see those? So they actually look like when you look through through the scope, it'll actually look like a crack in your windshield. That looks like that. It'll have dots, all those sorts of things that let you know that you have a cracked rod on the inside of your endoscope. Now, the main causes of those are just physician use, just general wear and tear. And then we also have the room turnover, transportation, reprocessing, and storage. So those are the last three that we can really control: the transportation, reprocessing, and storage. So as we're reprocessing, let's see, a lot of people do this with a rigid scope. Can't really do that because it's got that bend to it. This is a beyond repair. I'll pass this around as well. But passing this off, handling it in this way will start to bend that scope, and it will begin to crack. And it's like a crack in your windshield. It starts off small, and then as time goes on, it begins to spider web, and will only get worse over time. So we want to make sure we handle it with this end and hand wash. We do hand wash, right? Yes. Everybody knows. Now you can't go through the washer. You can't use the pre-cleanse on the rigid scopes. Everybody know that. You see that if the scope comes down into decontamination, it's got pre-cleansed spray. That spray that they should be spraying the instruments with on that, please let somebody know because they're not supposed to use that on these devices here. So general, you hand wash with your enzymatic solution, and then once you dry, do we have alcohol? Does everybody know where the alcohol either wipes or spray is in the department? Everybody feel comfortable with that? Be sure and use that at the end. Once you've got, you use detergent or any sort of enzymatic solution on there, you want to really be sure to use it on the eyepiece here and here, because if you don't get all of that enzymatic solution off of those two places, and then it goes into a Sterad, or it does get sterilized, they will actually make a detergent onto the window. So then it'll go up into the cloudy, that's usually what it is. It's usually not a cracked lens on the inside. The cloudiness is gonna be from an enzymatic solution or some sort of solution sitting on one of those windows there. Now, these are mostly for OR techs and their room setup here, so we won't need to go over that. But what we do need to do is at each point of contact that we have in decon, as soon as we get it and as it comes to the clean side, we need to just inspect the integrity of the scope. So I'll pass this one around here, and you'll see two types of tip damage are gonna be laser tip damage. Here it looks like kind of like an acid burn there, and here is a shaver damage. So in the case that they'll have next to the scope, they'll use either one of those two instruments oftentimes. And we want to be sure you see that. You can see on the tip there, it's got a little burr in the very tip of the scope. Now what can happen there is if we don't catch that, it goes into the next case, and there's tissue damage all the way down to the point of insertion, and then also bioburden just has a way of finding its way into those little nicks, crannies, and crevices there. Same thing with the laser tip damage. Looks like little moon craters everywhere in there. All sorts of bioburden. We could potentially have a damaged or a dirty instrument going into a case there, so we need to be sure and inspect that there. Another way to inspect is just by looking through the scope. Now, oftentimes people want to look at the ceiling up above or something 10 or 6 feet away. That's not how we want to inspect those. We want to inspect it up close and personal, and usually using like a count sheet or something like that. So you place your hand on the table and you look through the scope and you just give it a spin. That way, if there's a little dot or anything, the spin will let you know that it is there. A way to check the light source actually is you just point it, the light post at a fluorescent light above you, and if you can see the light source go on and off there. Can everybody see that? Mm-hmm. Just a quick way to check to make sure that's working. Now, transportation. We ever see this come down? People that work in decon. Does everybody work in decon?
He came like that
Yeah,
the other day.
The other day, light cords piled on top
No,
of it.
not the light cords, instruments only.
I'd say that is one of the easiest ways or the fastest ways to damage one of these. Because the way this gets bent is like I was showing you earlier, you're handling it this way, or just somebody drops it. It's called impact damage. But what can also happen is exactly what you're talking about. A Mayo scissor hits the side of this.
Mhm.
That's impact damage. That's gonna crack a rod there. So that's something that the other side, the OR side, needs to work on there, making sure that it comes down on its own. And what we're gonna talk about is isolated and immobilized. Those are the two words, isolated and immobilized. That's what they should be doing up there. That's what we need to be doing down here. That means it's on its own, or if it's in another tray, the other items in the tray are also secure, but it's on its own inside something, and it's immobilized, meaning once we start moving it, it's not rolling around. Because if it's just in a metal tray and it's hitting the post back and forth like that, that vibration can actually cause a crack lens as well. They are very, generally speaking, they are very delicate.
Drew, are you having this in service with the OR as well?
Jessica's in vascular right now, but we're gonna do this next week.
Okay.
We're gonna go through how to kind of set up a room, manage room turnover. We went to a place a couple weeks ago and they, stacked the trays. They stacked a tray right on top of a Rigid-Scope and then wonder why all the Rigid-Scopes are breaking. It's that sort of thing. Very simple. Once it's in decon as well, just make sure that it's sitting on your table as you're filling up your sink or anything like that. Just make sure it's just sitting on its own by itself. Just be aware of how delicate these can be. Any idea how much a Rigid-Scope costs?
About $3,000, $2,500.
That's about right. 3,000 a year. They can go up to about 7. To get them repaired is 500 to 2,000. So these are not cheap. This is not a Mayo scissor. This is not something easily fixed. It does take a lot of time to get it sent out and sent back in. So we just really want to be careful and good stewards of what we've got here on site. There's also another way to check for straightness. You can see this one's kind of bent. That's just another quick little trick is you just set it onto your workstation using the edge of your workstation and again, you'll give a spin. If you see it get sort of wobbly there, that lets you know that something's wrong. Even when you look through it, it might still look clear, but if it has that wobble to it, it's not really safe to use in a case as well. So it's gonna be damaged soon, and it's a patient safety risk, so we wanna watch out for that. Those are the main points of inspections in general anatomy. Does anybody have any questions or any problems? See, we need to go over that with OR, staff, make sure everybody knows that.
Yes, because when you said about the pre-plan, they spray 'em every day.
No, that's a big problem.
Yeah.
Okay. What they need to be doing up there is they actually need to do a pre-cleaning. You do it with rigid or flexible scopes too. Is in the room, right as soon as the case is done, they wipe down the gross bioburden there. They need to do the same thing with this. So they just give it a quick swipe with a cotton towel or like a little squeegee thing, and they just squeegee it off really quickly, and then they should not spray this with pre-cleanse. So try and keep a mental note of that if you do see that. Any other problems, questions, anything else with these? I do appreciate y'all's time. Anything else, Marcia, you need to comment on those?
Oh, I know. When they come to prep and pack side, you know, sometimes you can't see. What do we clean the tip with?
The tip of this,
Yes.
the alcohol.
Okay, just alcohol only.
Do you have a spray or do you have like the wipes?
We have
Like a
both.
little-
We have both.
We have
Both.
both.
Okay, you can use, because you can use the alcohol wipes to do that, but it's probably best to use the spray on a cotton towel.
Okay.
And use that,
Okay.
generally speaking,
On both ends.
on both ends, exactly.
Okay.
Cotton towel if you can, that's the safest. Anything else, anybody? Thank you all.
Thanks,
Thanks, Drew.